Paulo, Brazil. He will speak about acupuncture for patients with cancer. Eduardo, please.
Okay, so good afternoon. I hope everyone enjoyed their lunch. I'm going to talk to you about acupuncture on oncological patients. I'm really glad to be here. I'd like to thank all the organization committee for inviting me, especially Nasima, who saw my presentation in Bali and asked me to come here to talk to you. So this is the results of 2 years of practice in our hospital. It is a cancer center in Brazil. So the learning objectives will be to demonstrate the feasibility of acupuncture treatment for oncological symptoms. I'm not trying to treat cancer with acupuncture. We will be demonstrating the use of acupuncture for the symptoms that come together with the cancer and the treatment of the cancer. So I will display the current practice in Brazil and worldwide. Try to summarize the current knowledge of acupuncture use in the oncology field, and to discuss the TCM diagnosis for the most common oncological symptoms. So, as an introduction, in the last 4 decades, the public health burden of cancer is steadily growing, either in first world countries or third world countries like Brazil. So in 2013, our National Cancer Agency estimated that approximately 500,000 new cases of cancer in Brazil. So the treatment modalities are often aggressive and difficult to endure, and not rarely are followed by painful and debilitating sequelae. Our service is, we are located in this beautiful building, big building for Brazilian patterns, not as like the ones you have here, but still we are quite proud of it. The State of São Paulo Cancer Institute is a public hospital established in 2008. The acupuncture outpatient clinic started in March 2010, and we are seeing now patients 3 times per week with 2 attending medical acupuncturists. We are devoted to treat some conditions like postoperative, oncologic, and neuropathic pain, nausea and vomiting, hot flashes, aromatase inhibitor arthralgia, and xerostomia, which are all related to the treatment of cancer. For those of you that are not don't know this aromatase inhibitor arthralgia, what it means is that we use some hormonal blockage, especially in breast cancer patients, in order to prevent recurrence. So we do induce a menopause in these women, and it comes with a lot of symptoms. Hot flashes are one of those, but we also do induce some pain and migrating pain through the body, usually joints. So this is the aromatase inhibitor arthralgia. And xerostomia is the sensation of dry mouth due to the lack of production of saliva. This usually happens when we do radiotherapy to the head and neck. So in 2012, we published this paper at the Acupuncture in Medicine periodic, the evaluation of acupuncture for cancer symptoms in a cancer institute in Brazil. We shared the results of our first year of activity, showing an average of 60% of improvement in the symptom control after the course of 7 sessions of acupuncture. So this paper, our objective was quite simple. We just wanted to describe the population submitted to acupuncture and to evaluate the impact of this treatment in the symptom control for this population. We had 206 first patients, consecutive patients that came to our clinics. So we took a retrospective look and analysis of their medical records. We had to exclude 22 of them because of incomplete data or non-compliance to the treatment. The patient would come once, wouldn't like the treatment modality and never come back. But 184 were included in this analysis. The patients were basically, most of them were in remission, meaning that they had completed the treatment. They were still under surveillance from the oncological doctors, but they were not receiving treatment, and they were just facing the sequelae and the pains and enduring all those side effects of the treatment they had received. 30% of them were under active treatment, and 16% were under the hormone therapy that we use in order to prevent recurrence. So most of the patients were women with breast cancer. This is quite easy to imagine why. In acupuncture practice, most of our patients are women, and the most common cancer in women is breast cancer. So, and right after that, we had some patients of colon cancer that is also quite prevalent in Brazil. So the indications for acupuncture treatment at this first year were basically pain, because that's what we use to treat with acupuncture in Brazil. We have a strong belief in the use of acupuncture for pain control. So we received 45 patients for oncologic pain, 53 patients for lumbar pain and postoperative pain, and only 34 for chemotoxicities as a whole. So the methods were that we analyzed the symptom intensity through a VAS, visual analogic scale, and being the 10 the worst intensity symptom possible, and 0 with no disturbing symptom at all. And we did it on the first visit of the patient and after the first course of treatment. We found a normal distribution and did a simple paired t-test to evaluate the statistic. So this is the results from the first year. We had a quite good answer, as I said, 60%, an average of 60% of improvement. The patients would come to the clinic with an average of VAS initially at 7. And after 7 sessions of acupuncture, they would leave the clinic around 3 VAS. So quite encouraging, but still. On that occasion, we analyzed chemotoxicity as a bundle, since we did not have enough number of patients with the specific chemotoxicities, meaning nausea, vomiting, post-chemotherapy neuropathy, xerostomia, hot flashes, and aromatase inhibitor arthralgia. So now, with the pooled data of 2 years of activity, we were able to analyze each of these toxicities. So from 2010 until 2012, we were able to treat 77 patients with the symptoms listed before. And these were 19 patients for nausea and vomiting, 21 for oncologic pain, 13 for post-chemotherapy neuropathy, 9 for aromatase inhibitor arthralgia, 8 for hot flashes, and 7 for post-chemo, post-radiotherapy xerostomia. The results are quite similar, but we do see some differences in the response. We could see that oncologic pain does not respond as well as the other chemotoxicities. You see, like, chemo-induced nausea and vomiting has a very good response rate, like 60%, but still oncologic pain and post-radiotherapy xerostomia does not respond as well. Okay, but probably we could enhance the points or the treatment regimen that we are using. But still, we are having quite a good patient-referred improvement. This is all patient-referred. The markers are basically how the patient feel after we give them treatments. So the treatment that we've been using, some are very standard, like for nausea and vomiting. We've been following the current knowledge. It's quite popular knowledge that NAC1, pericardium 6, is very strong for nausea and vomiting. And we use also Susan Lee, stomach 36, electroacupuncture in both points. This is based on a study published in JAMA in 2000 by Dr. Shan, where she used electroacupuncture in patients that were admitted for chemotherapy, for myeloablative chemotherapy. That's when you try to deplete the myelo, the whole bone marrow, in order to do a bone marrow transplant. So it's quite intensive chemotherapy. It lasts like for 5 days, and she would give them electroacupuncture versus sham acupuncture, and she would measure how many times the patient actually vomited. So in the control group, she had like 15 episodes in 5 days. With acupuncture, she had 5. And with the sham acupuncture, which she used lung 7 and gallbladder 34, and she did put the electro machine, but it would turn on, make some noises, but no electrical stimuli. She would induce a placebo response, and it would go down to 10 episodes during 5 days, but still very different from 5 episodes that she got to with the true treatment. For oncologic pain, I brought 2 experiences that we have. Post-thoracotomy pain, also based in a very good paper published in the Annals of Thoracic Surgery. Also electroacupuncture. So this time, also patients that were admitted for surgery, they underwent the surgery, and after they received normal anesthesia with patient-controlled pump. So anytime the patient felt pain, could press a button, then morphine would be delivered to him, and he would give also electroacupuncture for another group, also with patient-controlled anesthesia. And using these points, Santiago 8, which is a golden point, as we call it in Brazil, very strong point for analgesia in the thoracic region. Yang Chuan, gallbladder 34, Heku, large intestine 4, and White Joe, which is gallbladder 36. Gallbladder 36 is the she cleft point of the gallbladder meridian, very good point for acute pain. So he demonstrated a reduction of 50% in the need of morphine for the patients that were receiving electroacupuncture. This is one that we came up in our practice. This is for post-mastectomy pain. The patients that undergo this mammary gland extraction, usually it's not only the mammary gland that goes out, it goes a lot of muscles and nerves, and they maybe from 30 to 50% of the patients that undergo mastectomy, they can develop chronic pain, and mostly because of the damage to the nerves. So this combination ran my Shenzong 17 with Tianzong, large intestine, small intestine 11, is a classic combination for mammary gland pain, and it's quite effective for these women. And also we've been using Kunlun, which is bladder 60, to treat the burning sensation that they get on the axillary region. So the bladder meridian does not actually go through this region, but the bladder sinew channel thus crosses this region. And it's also the fire point of the bladder meridian, so it's very good to treat fire sensation in the upper body. So we've been having good results with this. Also, if the patient has pain on the median side of the arm due to nerve damage, we use contralateral heart 3. And we need to get the chi, and the chi should run through the arm in order to release the pain. I'll have to run here because we have 5 minutes. Hot flashes. We've been using quite a complex combination of points, but mostly is that hot flashes we consider a kidney yin deficiency. So you have a yang preponderance, then you have this sensation of fire and hot coming now and then for these women, very unpleasant. So we reinforce the kidney meridian by using the full U, which is kidney 7, is the metal point from the kidney meridian. So it being the metal, it can nurture the child, which is the water. So you can nurture the whole meridian, or kidney meridian. San Yin Chao, which is the foremost point for reinforcing yin in the body. Also, Renmai 4 can reinforce both yin and yang. And some points to take out the heat, like Heku and do my 14. Yin Shi, which is heart 6, is a good point to control night sweating. So we also believe that there happens once you have a deficiency in the kidney, you have an imbalance between kidney and heart, so the water cannot control the fire of the heart, and then you have this outbursts of fire. So we do treat also the heart meridian. And for aromatase inhibitor arthralgia, we interpreted it as also kidney yin deficiency, but chronic. It can lead once the kidney and the liver have the same origin. Once you have kidney yin deficiency for long enough, you develop liver yin deficiency also, and this liver yin deficiency can bring up the wind characteristics. So you have this joint pain moving around the body, which is very seems like very plausible in these women. We've been using kidney 3, liver 3 to reinforce both kidney and liver. Yang Chuan, which is an excellent point for joint pain. Heku, which is a point for general pain. And Feng Qi, which is gallbladder 20, excellent point to treat wind. And last one, post-radiotherapy xerostomia. This is an excellent paper published by Dr. Meng from Fudan University, where he did acupuncture for patients that were undergoing radiotherapy in order to prevent them to develop xerostomia. So the patient was receiving acupuncture 3 times a week during the radiotherapy treatment, and after 3 weeks he showed that the group that was receiving acupuncture had a lower risk of developing xerostomia compared to the group that was his control. So the points used are these ones: large intestine 4, lung 7, stomach 36, kidney 3, Renmai 23 and 24 with electroacupuncture in the last ones. That's all. So the use of acupuncture may have improved the symptom control in these patients, but still this was a very simple study. We could make more well-designed studies with randomized, placebo-controlled groups so that we could actually provide more accurate results. So that's it. Okay.